Welcome, welcome, welcome to the second episode of Health Intelligence Brief. I am your co host, Corlette DeVoe, and my co host here with me today is Dr. Michelle C. Powell. Dr.
Hey
Powell,
everybody, hi. This
how's
is
it
Dr.
going?
Michelle Powell, and I am proud to be with my friend here for well.
Fantastic. So, we have a fantastic discussion that we want to talk to our viewers about today. Everyone can relate to this, right? Dr. Powell, what are we talking about today? Tell me.
Well, we're talking today about polypharmacy. Polypharmacy, because we're going to continue the conversation we had last week, where we were discussing that individuals were a lot of money. We were concerned about the healthcare dollars, and we found out that the healthcare dollars are being spent on polypharmacy. Lots of medication, often for the same treatment and often in the same class. And that happens a lot when people leave the hospital.
You know, we don't think about it, right? We started this discussion last week, as you said, and something came up that necessitated us continuing the conversation. We started talking about polypharmacy and what that means. So if we think about it, like you said, we all take some form of medication, whether it's over the counter or pharmaceuticals, right? Do we ever stop long enough to think, what am I taking? And does everyone that is important to my healthcare have visibility to all the medications that I'm taking? And do any of those medications interact with each other? Like, should I be taking this with this? Should I be taking that with something else? So we want to have this discussion today. And of course, our resident expert is Dr. Michelle C. Powell. Dr. Powell, what help us understand what is important for our viewers to know when it comes to pharmaceuticals, medications. What is important for them to know? Well, I see here that Dr. Powell is off. I was just disconnected, so I know she'll be coming in a second. But let me share some information with you while Dr. Powell is rejoining us. I've been in pharmaceutical sales for about 25 years, over 25 years. And one of the things that I learned as I was going out selling pharmaceuticals for Pfizer and Novartis was the importance of contraindications as well as drug to drug interactions. So, what that means is drug to drug interactions essentially means that if you're taking one class of drug, it may not be appropriate and okay for you to take another class of drugs because they may interact with each other. And when they interact with each other, it hurts you, right?
Correct.
So, Dr. Powell, you want to talk about your experience with drug to drugs interactions and polypharmacy with your patients?
Sure. I have a classic example. Someone goes into the hospital for a clot. They're currently at home. When they go to the hospital, they may be started on Coumadin, which is a blood thinner.
Mm,
So now you have someone who is in the hospital started on a blood thinner. They may be discharged with that blood thinner, but they still have the aspirin at home. No one has informed them to stop taking the aspirin while being on a blood thinner. Unfortunately, both of them are thinning the blood, and the end result can be very dangerous. It may be something as simple as bruising, your gums bleeding, but it can be something as serious as getting a bleed in the blood, which is a very, very serious emergency. Just pressure on can start bleeding. So it's or if there's a minor cut, they're cooking, minor cut, into a hemorrhage because now they're on a blood thinner and aspirin, which also thins the blood. That's a classic example of polypharmacy.
wow, that is a great example because you're saying if you're on aspirin, you shouldn't be simultaneously taking Coumadin or a blood thinner because they essentially do the same thing. Now, what happens if you go into the hospital, The doctor gives you aspirin, and when you get home, you continue to take your Coumadin, but then also another doctor that you go to does not know that you are taking those two, and they give you warfarin. Then what?
Yeah. And so that's a really good example because sometimes medications have, well, they always have two names and they have a name brand. And that doctor may prescribe you warfarin, which is a name brand for treatment. So now you're on name brand Coumadin, and aspirin.
That is correct.
Extremely, extremely dangerous. And the average person are not familiar with the generic names for most medications.
Hmm.
So as far as they know, the heart doctor or the cardiovascular doctor is helping them to keep it thin and not having a lot and not knowing that they're really going to possible an emergency.
So the big problem is, in my opinion, it's really not polypharmacy. It is more of visibility, knowing what I think the left hand and the right hand need to communicate and talk. If
Correct.
one doctor knows what you're taking, the other doctor knows it. All of the doctors are interconnected to know exactly what you're taking. They will have visibility to everything. So that would reduce polypharmacy, and that would
Yes.
reduce the risk of side effects or even death, right?
Yes. And Corlett, one of the things that you're addressing is communication and communication at every level. The on discharge, hospitals need to give the patient not only the medications that they were on, but the medications they should stop taking that. But they will only be able to do that if they know exactly what they're taking at home.
Hmm.
So they can't tell you to stop something they didn't even know you were taking. And this is where it's important for patients and family members to do what I always tell patients to do. Bring all your medication with you to the doctor's visit. And when you go into the hospital, bring all medications with you. And even more important for that, we have a lot of students in particular who like to keep medications after they're told to stop taking them. And so they're not aware that they're duplicating. So I may say to patients, stop taking Coumadin because you're taking warfarin. But they go home and put them in a bottom drawer.
Hmm. Hmm.
And then if they get sick, their family members hurries around, looks for everything, and grabs all the bottles. And unfortunately, they don't know that that drug was supposed to have not been included anymore. So the message is to avoid the high cost of polypharmacy. When a doctor says stop taking a medication, throw away. Take your name off the bottle, Sharpies, tear it off, pour the medication into a bag with coffee grounds and put it in the garbage. If it's a liquid, again, mixing it with and take the name off it and throw it to the keep it for tomorrow just in case. If these are antibiotics, if you didn't finish them, which you should, you have to do the same thing.
That,
Yes.
that is correct. So if a doctor tells you to stop taking your medication, please stop. If the doctor says that stop, like Dr. Powell said, remove your name off of the bottle, pour the pills out in a bag with coffee beans, throw it out. Because you don't want someone coming or a caregiver coming to your house and saying, "Oh, this is here. Let me give it to you," because they will end up overdosing you or hurting you in some way unintentionally.
Correct. Correct. So,
So,
so that, and the people watching out there, I want us to pivot a little to something we talked about finances and polypharmacy. I want to give you the power. You have a choice of what medication you pay for. Just because your eye doctor says to you, hey, we have a new eye drug, and I think, it's good for you to start for your glaucoma. More than likely, that drug is 3 times the cost of your current medication. Now, of course, if your glaucoma is not improving, it's time to try something different. But your glaucoma is controlled, the answers are really good in your eye, and you have no concern. Just a routine visit, and everything looks good. There's no reason to start a new more medication just because you've been on it for 3, 4, 5, 6 years. Many times we think for that we need medication because it's new. There's nothing wrong with something that works for you.
That's correct. You don't have to try the newest and the latest. Okay. And now another thought came to my mind, and that is refills. I
Mhm.
want to make sure to help people because I've experienced this personally with my own mother-in-law. If you have the pharmacy calling you every month to refill medications and you don't need it, do not refill.
Ooh,
To refill. If you have 6 refills on your warfarin, for example, and you already have warfarin at home, do not take the refill right now.
correct.
Secondly, if they call you to refill warfarin and you are no longer on warfarin, do not refill that medication. One, you're wasting money, and two, you are going to pick up that medication and now you are going to feel obligated to take it. And three, just because you have been on a medication for the last 5 years, if Dr. Powell tells you to stop taking it, do not take it. You no longer have to take it. It
Yeah,
doesn't matter if you've been on that medication for 5 years or 10 years. Follow your doctor's advice. This
yes,
is all for your safety. And we know that medication can help, but medication can also hurt if you're
correct.
using it in the wrong way.
Now, Corlette, on the idea of pharmacies calling you to fill medication, that kind of medicines you, one of the things I found in my office is polypharmacy, where patients will they'll go to one pharmacy, then go to another pharmacy, and then they'll go to one 3 miles away because it's near their job and near their caregiver's job. And then you have 3 or 4 pharmacies with the same prescription, but in different time periods.
Yes.
So one pharmacy may be your 90-day fill, another will have a 30-day fill, and then they're calling you to fill 30,
Right.
and the 90 days is not up yet, but they're in a different pharmacy. So sometimes it's very communicate. For example, if it's all the publics are linked, CVX, all the CVX are linked, but you go pick it up at public, then your caregiver picks it up at Walgreens, and now you have double the
Mhm.
same medication. It shouldn't happen, but you have to know when you're taking your meds, when you do, and say to them, you have to say, I do not need a refill. And I will encourage you to take single pharmacy patients, okay? And do the long term. Cheaper to get a 100-day supply, get 30 days with most insurance.
So what you're saying is do not do the polypharmacies.
Yes,
And don't do that. It is going to hurt. One
yes,
is hurt your pocket, and two, it may hurt your health because you're having multiple medications that you may or may not need. So that's so important. This polypharmacy is a big issue because what happens is, people talk about pharmaceuticals all the time. And they talk about this product is causing me to be sick. I don't
Mhm.
understand. Every medication has side effects in some way. You
Right,
may not be the person that gets that side effect, but every person is not going to respond the same way to one product.
correct.
So that's one of the reasons why you have to be aware of those side effects. But more importantly, you don't want to duplicate, you don't want to overdose yourself because if you do get side effects, those side effects are going to be exacerbated by doubling the dose or tripling the dose and taking more than you need to take. So,
Yeah, definitely. And Corla, and this is why I like Remember to so much because in real time, if you're taking a medication, for example, your loved one is, it's time for their blood pressure medication, but somehow they were given a blood pressure medicine because it was sitting there and the blood pressure drops. I mean, seriously and significantly drops. Something that could actually cause lightheadedness, weakness. Normal should be 120 over 80 and not lower than 90 over 60. To remember to constant monitoring that will notify you immediately if there's that sudden change out of the parameters that have been set. And it will be ever present to catch those side effects without correlate, where there's been an accident in taking duplications of medications, blood pressure medications, or even ones that regulate your heart rate, that drops your heart rate significantly low. And also, if you've missed your medication course and the pressure is not extremely high, remember to system allows you to be notified real time.
you're absolutely correct, Dr. Powell. You're absolutely correct. And then the final piece of that is all of this is for naught if the doctor and the loved ones do not have visibility. Visibility is extremely important for for our health. We want others to know. We want to know what's going on. We want one doctor to know what we're taking. We want the other one doctor to know what we're taking, and we want our family members to know what we're taking, why we're taking it, and should we continue to take it. What did my doctor say? We have to keep all of those things in mind.
Right,
And when you pull everything into one unified platform in one system to have visibility to see all of these things, then that is the approach, the new approach to healthcare, having
right,
visibility to protect our to protect patients and individuals. Because doctors can't help if doctors don't know what's going on. If they don't
mhm,
taking two medications that are the exact same, it's not the doctor's fault. They
mhm,
need visibility. So one of the things that Remember Two does is it brings all of that into one platform so that your care team can see exactly what you're taking and what's going on. Because
right,
this is about health. And that's why this is called Health Intelligence Brief.
right,
Because we want to brief individuals and people out there on things that they can do, things that they may not have thought about before, so that they can stay aware, educated, and have visibility to things that may not be good for them.
exactly. And Corlette, sometimes as a doctor will have a patient come in and they'll say, "What are you taking?" Because they didn't bring their medication,
Mhm.
and they'll say something, and it sounds funny, but it's really not. The yellow round pill,
Yes, yes, yes.
and I'm like, yellow. Okay, so okay, which is a yellow round? Okay, any numbers on the pill?
Hmm.
There's a one on it. I'm not. So at that point, we're guessing, and we have to take the guessing out of medications we're taking to help us. So besides bringing it to your provider, the doctor you're going to see, the Remember to system allows you to put all the medications that you're taking, if I'm correct, Carla, so that people can, the doctor, your healthcare provider, will be aware of what the guesswork, yellow pill, white pill, It's taken away. We don't do guessing.
No more guessing. The guessing game. Now, by the
Honestly, it's dangerous.
it's dangerous. By the way, Dr. Paul, so educate the our audience here because warfarin and Coumadin are the same. One is branded, one is generic. The pills may not look the same. They're
Yep,
not the exact same color. They may not even be the same shape, and they
yep,
may, right? So let's talk about that because when they say the red pill or the yellow pill, that could be any pill out there, right? The warfarin may not
correct.
be yellow, and
Yes,
a manufacturer,
there
they're
you
different
go.
manufacturers, different brands, generics or branded, they all look different. There's
Yeah.
no consistency.
That's really important. Based on where the medication is manufactured, they may use red number 50, yellow number 14, and it's the same for medication as the Coumadin. And that can be confusing because I now have a non-steroidal that's yellow, but
Mhm.
I could be with the pain. But then now my Coumadin is white and now it's yellow. The mind will say, I've been taking a white Coumadin pill. Something's wrong.
Mhm.
Let me go find the white pill. But Coumadin is no longer white, and the patient now may take a medication that they think is the Coumadin.
That's
But
correct.
now, basically, because the manufacturer changed the new color of the Coumadin to be yellow. So taking more than they should is a problem, but not taking it at all could be a problem also.
That's correct. And don't take a pill based on the color
No, no color. Okay,
or shape. Do
yeah,
not do that because every manufacturer, you go to Walgreens today and Pfizer makes a product and they give it to you. And then, of course, you go to generic, like Anda Pharmaceuticals, a generic company. That same product may be a different color and a different shape. So
correct.
please
Yeah.
look at the bottle, make sure you're taking the right thing, and make sure that you provide visibility to your care team so everyone knows what you're taking so you don't have polypharmacy that could potentially hurt you or your loved
And
ones.
for like, you know what, I want to educate our audience about something to know about medication. It's a word called flex. It's so important that you understand formulary. When you take out an insurance plan, that insurance plan also negotiates with certain medications, and they create what is called a formula, which is a list of medications for which they will cover.
Mhm.
They'll pay the whole thing, or they pay a minimum cost because they've negotiated that. So when you select, your doctor says, take this medication, one of a really good question is it on formulary? Your doctor may not know, but you can call your insurance company pharmacy and ask them if it's going to be on formulary. When you get to the pharmacy, and they may say like it's going to cost you $20 for this medication. More than likely, it's not on the contracted plan or what we call non-formulary.
Mhm.
Medications are also in tiers: one, two, five. One is usually generic. Generics usually are small when you get to the pharmacy. But level three
Mhm.
may go up to 25, and level five may go up to $300, and it's still on formula.
That is correct.
So it's still on the contracted plan, but it's going to cost you more. So that's where you can have a conversation with your healthcare professional or even a pharmacist and say, hey, what's the generic for this? Because I don't play name brand that's going to cost you three times the cost. And that's really important if you're really talking about financing and money as you expend it for your health care.
And generic is the less expensive form of a medication, right? And the branded is typically more expensive, and the generic typically is less expensive. So,
Now, here's what, Tori, I want to be clear about. And there's a myth that runs around. Because something is named generic and it's less costly,
mhm,
that it is inferior. Generic does not mean inferior. Okay, it means simply that a drug is out of the patent. Out of a patent means that a patent means no one can make that drug
mhm,
exactly the way this company makes drugs for a certain period of time. Usually it's about 10 years. After the patent is over, other people can make the drug and it becomes less costly because now it's out of patent and it will get a name called generic.
that is correct. It does not mean
So,
it's less effective.
right,
It's worse.
doesn't mean inferior.
Mhm,
I know a lot of patients are "Give me the name brand. I don't want the cheaper medicine because it's not as good."
mhm.
That's not necessarily true.
That is 100% correct.
Uh, so I really want to clarify that because often we go into financial, uh, compromise because we want the name brand when we can very well do a generic, like for instance, amoxicillin. We don't need to get amoxicillin,
Mhm,
okay, or azithromycin
mhm.
instead of name brand. You know it. Tell them
I sold those medications.
you
I know
have.
for sure, right? It's the active ingredient. And as you said, Dr. Powell, the pharmaceutical companies have a patent on a uh, molecule for a certain period of time, and that's the branded. Once it's off brand, then you others can now use the same molecule to offer that item less expensive. It is the same active ingredients. It's the same thing. And it's just more cost effective. So we do encourage individuals, as Dr. Powell said, ask questions. If it's on formulary tier one, two, or three, what is the cost going to be?
Right.
And and of course, take the medications your doctor prescribed for you to take at that time. If the
Yes.
doctor says not to take it, don't take it. That means you don't need it at that time. That's
Now
very
here's a good one I have for you. So
yes.
I had a patient come in, was in the hospital, given 4 to take for blood pressure, and this happens a lot. Dr. Powell, I want to take 4. So they wanted me to take them all at the same time. That's too much.
Hmm.
I'm just going to take one, and then at lunch maybe I'll take the other one, and then in the evening, I don't know. Depends how I feel. I'll take the third one. That's not how this works. Medications have times. Usually, if it's a daily, it has a 24-hour period that will work. It probably won't.
Hmm.
And some have it every 12 hours, and some may only have 6 hours. So if your doctor says take it all at the same time, every single day, please do that unless you have a problem and that's a conversation with the doctor. Not
Correct.
Dr. Patient and Dr. Google make the decision of how your medication is taken.
That's a very good point, and that goes back to visibility. First and foremost, you have visibility to what's going on with your patient, not Dr. Google. Okay? Not Dr. Google. And secondly, you're absolutely correct. The medications are designed and developed to stay in your system for a certain period of time. So if it's once a day, that means it will stay in your system for 24 hours. But if it's twice a day, that means you only have 12 hours. 12, you have to take it twice so that it never really leaves your system. It's always going to be at a steady state. And that steady state is where you're going to have that protection to cover and to address the concerns that Dr. Powell has for you. So don't take it upon yourself because you feel like it. Because what happens if you don't take it on time or as prescribed by your doctor and then something happens? Then you're going to be mad at your doctor to say your doctor didn't take care of you, they gave you something, you still had a stroke. So I encourage you, listen to your doctor, follow the instructions because they are there to do no harm and to protect you.
Yes. It's been a great conversation, I think, Paulette. I mean, it's so important, polypharmacy and talking about medication. And we just want to remind our audience that this has been brought to us by.
This has been fantastic. Yes, Dr. Powell, and we will be doing this every Wednesday at 12:30.
Yeah.
We will have a different topic. If you have a topic that you would like to hear, please just drop it in the chat. We will add that to the list of topics. We want to provide health intelligence information. So this is Health Intelligence Brief. We will provide brief overview and discussion about different things in the healthcare space.
Yes.
Reach out to us. If you want to just contact Dr. Powell or myself, you can send an email to support@rn2.ai and we will respond to you as soon as possible. Thank you so much. We will see you next week.
Great conversation. See you next week.
Thanks, Dr. Powell. Thank you.
Bye-bye.